They are the heroes on the front lines of the fight against COVID-19 in our city, leaving their families behind to take care of ours. Today, we're shining a spotlight on them and their lives. In our Frontline Diary segment today, we connect with Gwen Barton, who works in the Regional Cancer Program of the Ottawa Hospital. Gwen, good morning. Thanks for joining us.
Thanks. Good morning.
So everything seemed to have grinded to a halt back in March, but when it came to cancer diagnosis, that didn't stop, did it?
No, it didn't stop. It couldn't stop. We continue to support our cancer patients through chemotherapy and radiation. It did look quite different for them, to be honest. And, when they came into the hospital, they came and met with, screeners at the door and staff in full PPE, protective equipment. And unfortunately, for many of them, they couldn't bring in their loved one or family member who normally would support them through their cancer experience. But we continued, and we had to.
Yeah, making people like yourself even more important than ever before, because you essentially became their family, right there with them, going through probably the most difficult time in their lives.
Well, I'm speaking on behalf of our frontline providers. I'm not right there in front with those patients, but our frontline teams did some amazing work. They went above and beyond to not only provide the care that they normally do in such a caring way to make that patient experience as best as it could be, but they also became that person that provided all those extras for the patient when they were here getting treatment, because they did not have someone with them. That's absolutely right.
What's been some of the most difficult moments maybe for you to witness or that you've heard of when it comes to people who are fighting cancer in this pandemic?
I think I'll talk a little bit about from my perspective. And one of the teams that I work with here and lead is the Indigenous Cancer Program team. So we support a lot of our First Nations, Inuit and Métis patients and the organizations that provide care in the community and across Champlain. But we also work closely with the care teams in Nunavut, because we provide care for people who come down from the north for cancer care. And I think that experience has changed significantly, because again, very few are able to bring a loved one with them as an escort. But also when they're going back, they do have to spend 2 weeks in isolation here in a hotel before they go back. And most of them recognize the importance of that, but it is hard. And to the credit of the government and the people going through that isolation experience, they have kept COVID out of Nunavut, and I think that's an incredible accomplishment.
Yeah, I can't even imagine what that would be like, what they're going through in all of this.
Mm-hmm. Yeah, it is a challenge, but as I say, they recognize the importance of it because they want to protect their territory and all the communities.
As a frontline worker, I know for you, you've probably had to keep a tight bubble with your family. How has your personal life been impacted?
You're right. We do have a very tight bubble. I live with my husband, 2 young adult children, 2 very barky dogs, and a sister and a niece who lived across the street. So we were very creative in some of our activities that we did as our bubble, and to maintain that bubble, we did some paint nights in the backyard. My daughter is an artist and led a paint night. We did tie-dye one afternoon outside. We do movie nights in the backyard on a projector screen. So we try and keep our bubble tight, because there are 3 of us in that bubble that do work at the hospital. And of course, as young adults, we're hearing that they're now a sort of that higher risk group. So we do keep our bubble tight, but we do have some fun as well on our off time.
How do you think we're doing now, Gwen, as a city when it comes to fighting COVID-19?
Listening to the news and what's going on in other centers, I think we're doing incredibly well, and I'm really proud of our community, and I'm really proud of the healthcare workers who work every day to make sure that the patients coming to our hospital have great care and safe care. But I guess when we're thinking the future, I think that's one of the worries, is what's going to happen in the fall. Will we be able to keep COVID at bay to the degree that we have done so far and more recently? And how will the flu season impact us as well?
But I know you're ready at the Ottawa Hospital, right? You are a team of very well prepared professionals who are ready to handle this.
I can't say enough about my colleagues. They have stepped up and gone above and beyond. Just wonderful, wonderful demonstration of care in this very challenging time.
No doubt. Gwen Barton, thank you so much with the Ottawa Hospital. We appreciate all you're doing for us.
Thanks, Annette. It's been a pleasure.